Syphilis is a highly infectious, sexually transmissible infection, or STI, that is passed on during intimate skin-to-skin contact or vaginal, anal or oral sex with an infected person. It has several stages and can be infectious over a long time. The first signs of syphilis are often sores or ulcers on or inside the genitals, mouth or throat about 2 to 3 weeks after infection. They can also develop earlier, much later, or don't develop at all. This first stage of infection is called primary syphilis, and the sores, called chancres, can be any size or shape. The ulcers are often painless, don't bleed, and can feel like a hard button on your skin. You may not notice them, especially if they are on anal skin, inside the anus, or inside the mouth. If there is no treatment, the ulcers usually heal within a few weeks, but the infection does not go away. 2 to 6 months after getting infected, the secondary stage of syphilis occurs. Symptoms may include a flu-like illness, a rash on the torso, palms and soles of the feet, swollen glands, water-like lumps around the moist areas of the body, and hair loss. The rash looks like rough red or brown spots, but these are usually not itchy. Some people also get headaches, tiredness, and pains in the bones, muscles and joints. You can feel quite unwell during this stage. When the body detects an STI, the immune system tries to destroy the infection. If you do not get treatment, the immune response can cause secondary symptoms, which can come and go for up to a year after the initial infection. Even when these symptoms go away, you are still infectious. Some people will never develop symptoms and will only learn that they have syphilis after having a blood test. After 2 years of infection, you are no longer infectious to other people. This stage of the infection is called late latent syphilis, and treatment at this stage is very important to prevent long-term consequences. For some people, untreated syphilis can turn into tertiary syphilis sometimes up to 20 years after first infected. Tertiary syphilis can cause serious problems with nerves, the brain, and the large vessels near the heart. Blindness, numbness, and brain damage can also occur. It is very important for all women to be tested for syphilis during pregnancy, as an infected woman can pass syphilis onto her unborn baby through the placenta. This is called congenital syphilis and can be a severe, disabling, and life-threatening infection for babies. The earlier syphilis is treated during the pregnancy, the lower the risk of the baby being affected. Syphilis can also increase the risk of transmission of HIV and other STIs. Syphilis can be easily treated with injections of antibiotics. Syphilis and other STIs can be prevented by using condoms and water-based lubricant during sex, using sterile injecting equipment, and having regular sexual health checkups. If you are diagnosed with syphilis, you must ensure that you or your health provider notify your sexual partners so that they can get tested.